Hello, everyone. On behalf of the EPDA, thank you for the invitation. My name is Josefa Domingos. I am a physiotherapist by background, specializing in community-based exercise for people with Parkinson, and with a special passion for dance as a therapeutical tool. Now, we all know that growing research supports a number of community programs for people with Parkinson, such as the boxing, the Nordic walking, the Tai Chi, aquatic exercise. And dance is definitely one of the primary ones. So one of our goals today is really to raise awareness that given its benefits, dance can, and I would say should, be incorporated and adapted into clinical settings besides its common use as a leisure activity in the community. Now, as dance continues to gain popularity in the Parkinson world, more and more people are embracing dance as a way to improve physical and non-physical needs. Now, even though we can apply different names to it, there is a clear difference between what I call dance as leisure and dance as a therapeutical tool. Now, both are essential, beneficial, and needed, but what are the differences between them? Let's take a look in the video to see if we can identify that. So on one side, we have one video that is 3 people with Parkinson doing Irish dancing. Okay, then on the other side, we have a gentleman also with Parkinson. So on one hand, we have dance, in this case Irish dancing, that is done for enjoyment, leisure or pleasure, with unique patterns. Dance as a therapeutical tool, on the other side, is a form of therapy which relies on the relationship between the patient and the therapist in trying to have a joyful experience that comes with goals and a treatment plan. While both may achieve common grounds, such as enhancing self-confidence, mental health, and body awareness, the process by which this occurs can be vastly different. While therapeutical dance focuses on specific movements and goals, dance as leisure typically focuses on psychological goals and social interaction. If we were given the choice, which should we choose? Firstly, do we have the choice? Where do we live? With the online coming in very strong, maybe we do have that choice now. Now, if we can choose, why and how would I choose one or the other? And let us try to understand why they actually came about. So why do we talk about community dance for Parkinson? Where did this need come from? If we think about how people spend their time with people living with Parkinson, how they spend their time, this is nicely reflected by the image by Sarah Rigon. And she tells us that to manage her Parkinson disease, Sarah spends 1 hour with her neurologist, 50 hours maybe with her physiotherapist per year, and the rest of the year she is spending on self-care. So naturally, there is a clear need to have an exercise solution that people can have close by and be accessible. There was an interesting study that was published in 2015 that showed that they followed 187 people with Parkinson for 20 years of Parkinson, and saw that clearly 47% of the people were doing physiotherapy and 54% were doing some form of exercise in the community. So again, the need is reflected by a gap in care that has to be filled. Now, there are reasons to be optimistic about these new initiatives, as they are a long-term and cost-effective and easy accessible care strategy that will help us with exercise adherence. However, obviously data and evidence regarding their true benefits and the best approaches to implement them are still quite limited. Unfortunately, there are some drawbacks and limitations, particularly with respect to safety and integrating these exercises and reducing the risk of falls and other possible safety issues. By prematurely referring people with Parkinson to exercise approaches that do not have robust evidence and led by instructors with a lack of professional expertise, health professionals may favor unnecessary procedures and foster unrealistic expectations in people with Parkinson. We could ultimately be putting patients at risk of falling or injury. And so several important questions regarding the specificity to people with Parkinson and safety issues are now arising that should fuel us into future research. When do we use it for the different phases of PD progression? With whom? Should we exclude any particular people? What are the risks? What should be the duration and the frequency of these classes? What are the most effective dosage and type of dance? What should be the focus of the dance? How should this class structure be designed and implemented? The dance styles, how repetitive should the content be of the class? Should the participants be separated into groups? Based on what criteria? How does dance assist music assist us in the dancing as well? So there are lots of questions, and I would say an important one is who should deliver it, the dance instructor or the physiotherapist? Taking into account the financial considerations, the accessibility, safety issues, as well as the progression of the disease, who should implement such community exercise programs? Should be the physiotherapist that incorporates the dance and whatever exercise the boxing or tai chi into their clinical practice? Or would it be more feasible and equally effective to train the exercise instructor teaching in the community? And if so, what should the dance instructor or dance assistant learn about Parkinson's disease? So it isn't as clear as we might consider. Now, we might not have the right answer at this moment, but some solutions may potentially help. Here's an example of a program that we implemented in Sweden. We used boxing as an example, but the baseline of this paper was really to be able to share a different form of being able to implement programs, community programs, where we developed specific educational resources to facilitate the boxing instructors in this case. We also organized a whole educational package workshop for the patients and also for the clinicians, alongside the clinical input throughout the whole program. So it could be just an alternative way for us to be able to implement these programs with a little bit more specificity to the disease. Now I talk about therapeutical dance for Parkinson. There are clear benefits of recognizing that dance is more than just dance. It has numerous benefits over health, with research to support its benefits on motor symptoms such as gait and balance, and non-motor symptoms such as quality of life, mood, and cognitive function, and even on dual tasking. Besides its popularity among people with Parkinson, clinicians are now confronted with the fact that it has proven clinical meaningful benefits in Parkinson's disease when compared to either no intervention or other exercise interventions. So now it's reasonable to believe that an efficient dance program in this population should include specific movements and activities to bring additional advantages. So as therapy, it will have additional advantages if we consider several factors. Let's go through them. The first advantage is definitely it allows us to focus on specific movements that might be more beneficial for Parkinson's disease. The patterns movement patterns that like starting, stopping, stepping sideways, stepping, challenging the body's ability to anticipate and respond to different tasks and environment constraints. Let's see these things in the videos. So you can see how we can really focus on very specific things for Parkinson, the amplitude and speed-based movements, the multidirectional stepping. Secondly, we can also use cueing as a form to maintain good motor performance, like visual cues, as you can see in this video with this 61-year-old gentleman with Parkinson's disease for 20 years. And there we can have a different type of cueing. So we can use visual cue on the floor, as you just saw. And here we are using some sticks to be able to create an additional auditory cueing of that guarantees the amplitude and that the gentleman is in the right rhythm and getting to the right place. So thirdly, we can also use groups, and these allow us to be able to train specific movements the same, but also keep the motivation through socialization. So I'd say that dance is really one of the most important forms because it actually helps us keep people motivated to attend classes regularly. And this was actually backed up by research that showed a high rate of compliance with low dropout rates. And often people continued after their activities, often participating in research studies of dance. And even though studies of exercise in Parkinson have not yet separated the social benefits of the group therapies, the supportive and social nature of dance classes can't be ignored. They really give a sense of togetherness with a group, a sense of purpose and being part of something. Let's see an effect of this in this video. So I had added in a special twist to the exercise, dividing the group in two. And the white line behind me was if I go to one side, they would follow me and the other group would not do anything. If I was in the middle, both of them would do it. And if I was on the other side, the other group would do it. So it brings in a little bit of engagement and competition between the groups to see who's more attentive. So another advantage would be using voice and motor training through music and dance. And this is more like a transdisciplinary approach where we combine motor, physical and voice challenges together in a dual task training kind of method. And let's see a bit of the video. So what we have the speech therapist actually in the room, and we have associated key words that would be beneficial for people with Parkinson that we are exploring in this at the same time as they do the exercise. So another advantage would be to use cognitive and motor training through dance as well. And we already know that the aerobic component is strongly related to better cognitive improvement. But we also know that combining cognitive and motor tasks also have an additional benefits. So let's see in the video, we will see that our primary goal will be gait and amplitude and physical capacity, as well as speed. And then we have a secondary cognitive task as well, which is targeting sustained and divided attention. Let's see the example. So we have associated odd numbers to going down and even numbers to going up. And as the therapist is saying it, the person will have to react to it at the same time as they are having fun with the music. There are 5 practical considerations that I would add onto a therapeutical dance. Namely that it should be emphasized that it's not really about becoming a dancer, but it's about the movement and the exercise, as especially men will not want to try it because they think they're just not meant to be dancers. So by highlighting this, it allows people to really take at least a chance. Secondly, we have the classes, of course, should be both safe and therapeutical and engaging. So we should never lose this component of engaging, because that's the main difference between the therapies. When we think about safety issues, we think about the group size. So group size is still based on professional preference and probably the context. The European guidelines recommend the maximum of 8 people per group, this for one therapist. So it all depends on the amount of support that people are able to have inside the sessions. You can have more people as long as you have support enough for the people that are more at risk. Another safety issue is being able to identify red flags, or I would say emergency situations. And whoever we decide on delivering these classes, this knowledge is critical. For example, being able to identify significant sudden motor fluctuations, like uncontrolled violent dyskinesia, severe on-off, the onset of active psychiatric problems like confusion or psychosis, uncontrolled orthostatic hypotension, PD-specific problems that might also appear like risk behaviors, impulsivity, severe changes in posture, not to mention the most obvious, which would be freezing of gait, increasing the risk for falls. Not only associated to the exercise that we choose per se, but also taking in consideration that busy environments and negotiating all the attention needed for everyone speaking, all these are possible to provoke hesitations in movement. So number 3 would be carefully selecting the music so that it's music people like and not music that the instructor likes. So lots of research around this topic has already been done, highlighting that the more closer the music is to what people like, the more the connection they will feel. So the greater the benefits. Maybe we could create a playlist with a favorite song from each one of them, and as it goes by, then each one will be happy. So I honestly usually use Zumba music just because it has all different Zumba. It has flamenco, pop, merengue, salsa. It has all different diverse sounds that can please each person. What about number 4? I would say teaching methods. So professionals, obviously, we have our convictions about how things should go, and often I've seen in dance classes the music only comes on after all the steps have been memorized, and I think that steals a lot from the class. Really beginning already with the rhythm and the music puts you in a different place for the training. And I think when we are talking specifically about Parkinson's disease and being really obsessed about having the steps in the right way, in the right form, again, if our goal is for people to exercise and to exercise safely, with maybe it's not so relevant because they are not going to become dancers, right? Then finally, the stages of the disease will obviously influence the way we choose what we do, right? So we might have something like this for early stage. We might, in the middle stages, have something like this. Where we are using more cueing and giving more support to the person. If we think about later stages, and here I'd give an example of someone really suffering from cognitive issues, and we can have different methods of teaching, but it's still feasible. People might have more difficulty, but... So what we did here is someone with Parkinson's disease dimension, we invited another person with Parkinson to help us, as if we were a girls band actually, in pink, and we called ourselves Pink. And just by mirroring the situations, if it was only me, the person would not react, but because we had another person with us, it was easier to have at least mirror movements. And then after I was attentive to what the person could do, and then grabbing onto those movements in order to enhance them. And I must say it was the most movement that I got out of the woman that day. So this brings us back to our question, to choose one or to choose the other. So choosing really depends on the ultimate goal of your focus on the dance. So depending on the reasons why an individual is engaging in the activity, he might want something more or less specific. So for example, if you are dealing with someone with motivation issues and apathy, you might want to consider doing anything, any type of exercise, any type of dance, because anything is always better than nothing. You might have someone that also doesn't want to be in a PD-specific environment. So dancing might be a good way to do exercise in the community. Now, if you are looking for something specific, like improving your walking, your turning, your initiation, and if you don't have access to a professional that can focus on this and even using music or not, maybe you can select a type of dance that will actually focus on those components of the movement. Like, for example, you could do tango. Tango, as it requires frequent movements of initiation and stopping the movements and spontaneously changing directions and movement speeds. And this may target, movement and walking and turning. So maybe instead of choosing ballet type of class, that may be challenging more the amplitude and the flexibility, so that you have a good posture and good alignment. Tango might be the option for that, for improving walking. But it always comes back to, of course, preferences and you being able to enjoy whatever one you choose. Now, my take-home messages is really about the growing and the spread of community programs such as dance requires some changes in thinking by healthcare community in order for us to define how these services can better, complement current clinical practice. without careful translation of the evidence that's coming out and how to implement it, no amount of research will ever make any difference. My second take-home message is effective community exercise program must be made available and accessible to people with Parkinson worldwide as a means for us to promote better care for people with Parkinson and ultimately also reduce costs on healthcare systems. So another key message is that both therapeutical dance and dance as leisure are beneficial, they are needed, and in many cases necessary. And necessary because on one hand, we need to have cost-effective and accessible care strategies implemented in the community for people. But on the other hand, if you do have the choice to have a specific and equally enjoyable and accessible exercise, ask yourself, why would you want to do non-specific exercise? So there is, I would say, a need for us to really make combine the right ingredients and get that to everyone. And the final key message, and the one that I started with, is really that dance should be incorporated and adapted into therapy activities. Hopefully you saw some good examples of how that was done through the videos, and not only be restricted to the community settings. Thank you so much for your attention.